So Kofuzi is a little confused. Let me see if I can help him out a little bit with this glute activation thing. How's it going, runners? My name is Justin Thompson. I'm your average running PT, and I help the average runner achieve their own personal elite status. If that's something you guys are into, then go ahead and hit that subscribe button and click the bell so you know when the next video comes out. So I've been following along a little bit as Kofuzi's been going through and kind of telling us about his knee pain problem. Now, I admit I haven't watched every single video since that knee started hurting, so I don't know the entire history, but I did get a pretty good indication as to, what's kind of going on with it on his video that he posted today, where the title of the video was Glute Activation. I don't get it. So I thought that I would chime in as a PT. I think that I have a little bit that I can maybe say here. Hopefully shed a little bit of light on it, but, hopefully I'm not just regurgitating what other people on the internet are saying. So Kofuzi's been telling us all about his right knee pain that's been bothering him for some time now, and, he keeps saying he needs to go to a PT, but don't really want to because of coronavirus and all that kind of stuff. Believe me, I understand that because nobody's coming to see me right now either, so I get it. Totally understand. Don't want to get out and get in the mess of coronavirus at this point. So totally understand. So hopefully I can shed a little light on it. But he's been saying that Saucony shoes especially, but really stability shoes seem to be what's kind of leading to some of this knee problem. Now, we don't know that with 100% certainty, but it's a pretty good correlation where he goes out and he runs with these Saucony shoes, and it seems to be pretty much the whole Saucony brand, the whole Saucony lineup, that tends to cause this kind of a problem. Now, he reiterates that it's probably not the shoe's fault per se. At least the shoe is not a problem for a lot of people. It's just that maybe it's not quite agreeing with his body or with his running patterns. So of course there's a lot of people chiming in, what should Kofuzi do about this knee pain? And everybody's saying, well, you gotta work the glutes, you gotta activate the glutes, and what in the world does glute activation even mean? And so I'm hoping that I can shed a little light on that. So real quick, the knee is often called the dummy between the hip and the ankle. So the knee is a fairly simple joint. Obviously there's a lot going on in there with all sorts of different structures, but essentially, it works as a hinge, so it just bends and straightens like the elbow does. However, similar to the wrist and the shoulder, there's a lot more going on above and below that knee. So the hip and the ankle both have 6 degrees of freedom, and what that means is it can move in flexion, extension, abduction, adduction, pronation, supination, all of these different kinds of movements that create this ability to circumduct the hip and also circumduct at the ankle as well. Now, with all of this freedom of movement, what it creates is a need for a lot more stability at the hip and at the ankle. Now, the whole idea behind stability shoes is to be able to create an external stability on a unstable ankle. But not everybody needs that stability at their ankle, and therefore it can actually throw things off up the chain. So that's where the shoes come in. The Saucony shoes could be creating more stability than what he actually needs, and therefore throwing his body out of its normal natural alignment. In truth, the foot needs to be able to pronate, and if a shoe is preventing pronation, then the body's not going to be able to respond or react to that in a positive way, especially if it really doesn't need that extra motion control. Now let's talk a little bit more about some of the other things that he said that he's experiencing. So he also experiences some tightness in his right hip, which is on that same leg when he's running. So that's another kind of correlating thing. There is also an occasional low back pain that happens whenever he is running longer or faster. So we can talk a little bit more about that too. But the big thing in question right now is glute activation. First of all, what is it? How do you do it? how long does it stay activated before it turns back off again? Now you've got three different muscles in your glutes that create a hip stability. You've got the glute max, which is the largest muscle on the back side of your hip. You've got your gluteus medius and your gluteus minimus. These two provide lateral stability to the hip as well. Now all of these muscles work together. They don't work just independently. They work together to provide good hip stability around that joint. Now if they're not working well together, then that could create problems up or down the chain. Now you may have seen or heard of the Trendelenburg kind of a gait where somebody lands on one leg and their hip drops because they don't have enough hip stability in that side. Now obviously that can create problems at the hip, but it can also create problems down at the knee as well. And when combined with a poor level of ankle stability, then that can really create a lot of problems. Now, I don't know what Kofuzi's doing throughout the day, but I do know that there are a lot of people in our culture, in the United States and America, that do a lot of sitting. And with sitting comes sitting on your glutes and basically turning those things off while you're sitting. Now, why do they get turned off? Well, basically you are compressing them and preventing blood flow to them. Therefore, they actually will start the process of atrophy while you're sitting there in your chair for 8 hours a day. Now, on top of that, you're also sitting in most likely a 90-degree angle, so your hips are stuck in this position. So whenever you're in this position, your hip flexors also become significantly shortened whenever you are there for 8 hours a day. Now that might not mean much over the course of a single day, but you add up a bunch of days in a row or years in a row of working in the same kind of a sitting position, those muscles on the front side of your hip can become significantly shortened to where you can't really extend your hip very well at all. So now let's combine a shortened front side with a weakened back side, and now you're talking about having to use other things that may not be what you're supposed to be using during your running gait. And this is a lot of times what happens when people say that they are quad dominant or calf dominant, where they will use their quads to overcome the weakness in their hips, or they'll use their lower back in order to overcome that same weakness in their hips. Now, Kofuzi also mentioned that kind of discomfort or pain in his back when he goes longer or faster, and that could be because he's having to overuse his lower back muscles in order to overcome that weakness in the hips. Now, this video isn't meant to be prescriptive necessarily, so I don't want to say that this is what he needs to do, but in general, what I notice with a lot of the runners that I treat and work with is that in order to actually get their glutes activating again, is we have to get them moving through a full range of motion. So I'm immediately going to start to encourage them to do some hip flexor stretching and some glute bridging as well. Now, Kofuzi did say that he is already doing some glute bridging or hip thrusts, and I'm right on board with that. So that's what's cool about this, is I think that he's kind of figuring it out himself, but hopefully I can add just a little bit more that might help with the process. So when I talk about working on that hip flexor flexibility, what a lot of people might think of is doing that kind of runner's lunge stretch, and that's a fantastic stretch to do. However, most people don't do it for long enough. Now, I know there's a big old debate about whether you should be doing static stretching or dynamic stretching, and there's a place for both of them. Whenever somebody does a lot of sitting, a lot of sitting, I recommend people hold that stretch for at least a minute, if not two, because it takes about 30 seconds to a minute for you to get past just the neurological tension that's already loaded up in your hip flexor. Beyond that, now you're starting to actually work on the structural lengthening of the tissue itself. Now, once that tissue is lengthened, then you can start to activate the glutes a little bit more. Now, you have to make sure that you're not just activating the lower back in order to perform the glute bridge that I said that I would normally recommend for people. So whenever I have people do a glute bridge, I definitely make sure that they first perform what's called a posterior pelvic tilt, flattening their lower back down into the floor, and then maintaining that core contraction while they use their hips and glutes to lift their legs, or to lift their hips up into the air. Now if you're doing this before a run, it doesn't take a lot to, quote, activate the glutes. It just takes maybe 10, 15 repetitions just to kind of fire them up and get them working, as long as you're using the right muscle group. But if you're wanting to actually strengthen them and get them kind of ready for maybe a longer run, then I wouldn't do it right before a run. I would do it at another separate time, kind of your own personal little rehab time, where you're doing these kinds of exercises to fatigue. So that may mean that you're doing 20, 25, 30, 50 of them in a row until you feel like your muscles are really, really worked. Now again, this isn't prescriptive for anyone right now, so if anybody has any questions about this, definitely reach out to me before you just start jumping and diving into this stuff. Now the question of how long do they stay activated? Well, if you do this quick activation, 15, maybe 20 reps or something like that before a run, then you're probably going to be fine as long as you just don't go sit down and turn them off again. They are most likely going to stay activated for however long your warm-up takes, or for the 30 minutes that you're just up walking around. But again, if you go and sit back down, then it only takes about 10 or 15 minutes for you to basically shut down the blood flow to those glutes, and now they're becoming ischemic again and start to turn off. Now of course there are a lot of other exercises that you can do. Kofuzi mentioned some of the ones that I typically prescribe to people. He mentioned the clamshell, he mentioned lateral leg raises, donkey kicks, things like that. But for me, my go-to is almost always a glute bridge. Now, just as a final disclaimer here, this is not prescriptive for anybody. It's not even really prescriptive for Kofuzi. It's just supposed to be informational for you guys, so that, hopefully you can understand a little bit more about glute activation and what that actually means and what you actually need to do in order to get them activated. So leave me a comment down below. Kofuzi, leave me a comment down below. Let me know if this was helpful at all. If not, and I just added to the mess, then I apologize. But anyway, that's my take on glute activation and how you guys can help with that. So head on out there, seek your elite. God bless, and I'll see you next time.